Hi, I'm Dr. Ngaree and I'm one of the recipients for the 2023 Australian Centre Seed Funding. I'm a proud Noonuccal, Goreng and Yorta Yorta woman. I've grown up on Wurundjeri land and I acknowledge and pay respects to this country and the elders who have looked after me and also the ancestors of this place. I work as an academic here, but I'm also a medical doctor in public health. And my role here at the university is that the director of the Wurru Wurru Health Unit, and we focus on teaching, developing curriculum and research in First Nations health. I just want to acknowledge that through the Wurru Wurru Health Unit, we pay respects to Wurundjeri people by using a Woiwurrung language word, Wurru Wurru, which is a word that is used to describe sky country, which is part of the 6 layers of country dreaming story, which has been shared with us by the Wurundjeri people. The research that myself and my team at the Wurru Wurru Health Unit are conducting is based on a specific subset of the First Nations community. We're looking specifically at gender and sexually diverse communities within First Nations people. What we found is that health professionals are given very limited teaching around gender and sexually diverse communities in general. And then if we also look at that within the First Nations community, we find very little data and evidence around this space. What we wanted to do is create a training package that was for health professionals and also health profession students that could be used at the university and also more broadly to educate health professionals about how to be culturally safe with gender and sexually diverse communities. What we've called this is rainbow mob health. This has been a term that's been used across a few different sectors and also across community because it not only represents the diversity of our people in this particular community, but it also links us to country and place. And we've also partnered with the Victorian Aboriginal Community Controlled Health Organisation so that this can reach more broadly than just the university, but out to all health professionals that are working within so-called Victoria. My work aligns with the Centre's values because I understand that the Australian Centre is really focused on the relationship between settler Australians and First Nations community. And being part of First Nations community, I want to see this happening a lot more, particularly in the area of health, because within the healthcare system, majority of the doctors, nurses and other health professionals are not First Nations, and yet a big part of medicine and healthcare is in relation to First Nations people. So this is an area that I'm really passionate about, and I really want to see more settler Australians recognise and value First Nations people, cultures, and also see that there's huge equity issues that need to be addressed. What's important to me about this work and what really drives me and motivates me in this space is my passion for health promotion and education, because I believe that's key to not only empowering First Nations community in their own health knowledge, but it's also key in ensuring that we have a culturally safe health workforce. As First Nations people, we are a collective, but we're also very diverse, and we have over 250 different nations, and within that we have a lot of intersections around our gender, our age, our sexuality, our abilities, all types of other intersections that can influence how we have lived experience of this place, and also the perspectives that we have within our communities. So this is why I think that hearing directly from First Nations communities, particularly in this project, is so vital, because we need to be hearing the voices of multiple First Nations communities to truly understand the diversity in this space, so that we can then make sure that we have localised, specific and culturally safe health resources, so that we can ensure that we have better health outcomes for First Nations communities here. What I hope to achieve in this project is, this is just one small part of increasing the awareness and education in the area of First Nations health. And ultimately, I want to be bringing along the community that have supported me and also those people that have come before me to honour the knowledge that has come through from the past generations, but also to honour the current lived experience of First Nations communities. Ultimately, my big end goal is that we don't have to worry about health outcomes for First Nations communities, because there are equitable health services out there. And I think a big part of that is the education piece and making sure that we have research that is evidence-based, localised and specific to communities that we're serving. The seed funding has enabled our work by actually formalising the partnership with the Victorian Aboriginal Community Controlled Health Organisation. Through that formal partnership, we've been able to run some community events and get feedback directly from community about what we're doing and how we can improve it. And on top of that, we're able to just have a broader representation of voices in our project. What's important about Rainbow Mob is that our communities have always acknowledged that gender and sexuality is very diverse. We've never sat within a binary around gender or around sexuality. I think this is something that's been imposed on our communities by the settler colonial state, and that's why I think that this project aligns so much with the so-called Australian Centre, because we can change views and norms and narratives around Rainbow Mob, and that can hopefully then bring awareness to health professionals so that we are able to have culturally safe spaces for Rainbow Mob to access healthcare and to feel heard and seen.